Blue Cross Blue Shield, an in-depth look at who and what makes up Blue Cross Blue Shield. For the teachers, Blue Cross was created in 1929 to serve educators employed at Baylor University and grant them easier and more affordable access to health care. The Baylor Plan was a system in which educators at Baylor University paid fees to access discounted inpatient services at hospitals which participated in this network. This model quickly gained traction and spread throughout Dallas. The first iteration of the iconic Blue Cross was created and utilized by E.A. Van Steenwyck and was a solid blue Greek cross. This iconography would eventually be recognized across the nation. For the workers, 1930 is the start of what would eventually become the Blue Shield plans. The National Labor Relations Act and similar legislation bring workers and their rights into the national spotlight. At this time, there was momentum in physician participation with voluntary health plans. The Blue Shield plan began in earnest in 1939 and was intended to pay physicians' fees. This model would become the framework for how healthcare insurance operates today. For the people, the 1950s and 1960s usher in an exponential growth for the Blue Cross and Blue Shield plans. The U.S. government chooses to partner with Blue Cross and Blue Shield companies to administer Medicare due to this exponential growth. Estimates suggest up to 70% population coverage under this health insurance. These separate identities would merge with each other in 1986. As a result of this exponential growth and innovation, Medicare is now the largest health coverage program in the U.S. For those we protect, Medicare is divided into Part A, inpatient hospital services, Part B, physician and healthcare provider services, Part C, a bundling of A, B, C, and D, and Part D, prescription services. This program is targeted for individuals 65 and up, and for individuals who have more complex healthcare needs. Medicaid, for those individuals who meet income metrics, for families who need assistance, and for those individuals, again, who have more complex healthcare needs. Young individuals with disabilities, and Medicaid is seen as a safety network to provide the access to healthcare across a greater population. A quick resource guide. Starting here, we can go to the CMS Medicare.gov, and this will take you to an easy to utilize and easily organized resource into getting started with the program. See what Medicare can cover. This website will show you tests, items, or services that are covered, what Part A covers, what Part B covers, a good idea of what is not covered, coordinated care programs, and getting care in disaster or emergency. A forms list. I thought that this would be a good resource to use because this is a directory of the forms that are utilized, where to get them, how to fill them out, and other information that seemed important and relevant. For Medicaid, this is the official website for Medicaid. Medicaid for North Carolina through the Department of Health and Human Services. And in researching for this presentation, I learned that North Carolina, as of 2023, just had a very large expansion. Looking at the information given, I was able to see a family size of 3, which is my family size, and it really does expand the eligibility for a very large demographic of individuals who live in North Carolina. It says over and over again, even if you weren't originally eligible in iterations before, it would be good to look for and see if you are currently eligible now because it has been wildly expanded. For those who explore, no matter how far your travels may take you, there are coverage options that may tailor fit your needs. Medicare coverage options, employee benefits, support for outgoing students, and support for incoming students, and global access. This is a very quick and in brief idea of what plans are offered through Blue Cross Blue Shield. And again, in researching, I learned that my family's policy is a PPO through my husband's employer contracts. For those just starting, in researching this project for Blue Cross Blue Shield, I wanted to find more information relevant to the policy that my family has. For the most part, I had left this entirely to my husband and didn't really know or understand very much about how this worked. In researching, I learned that the numbers on the card are important, and they can really help you figure out how and where to go. I called those numbers. I learned which providers were in the network and were covered, and I was even able to access a primary care physician for my family. There's also a benefits manager number and website that can help you figure out what you have and maybe what you need. This is an area in which you can go and decide which parts and pieces of a policy that might fit your needs better. Blue Cross Blue Shield allows for licensees which may or may not provide similar coverage. This can cause some confusion, so be sure to contact your state's department. In researching for the presentation, again, another very important piece of information that I learned is that we actually have Capital Blue Cross Blue Shield, which is a licensee of Blue Cross Blue Shield, and that what BCVS might cover might be different than what is covered for Capital Blue Cross Blue Shield. In previous interactions with healthcare, individuals at the intake desk would look at the card provided and seem very confused because Capital Blue Cross Blue Shield is headquartered in Pennsylvania. This was a point of confusion, and when you contact the state's department head or department area for Capital, you can get some documentation that will make that process much smoother. Taking the time and logging into your website and managers can really help you keep track of what is going on and how to make smarter decisions. This is where you can reach your private health information. This is where you can keep track of what claims are current and in what stage they are currently sitting at in being processed. Thank you for following with me in the look of Blue Cross and Blue Shield.